A health alert now about melatonin, which helps millions of Americans fall asleep. But tonight, a new study says if you use it long term, it could be a warning sign for your health. NBC's Ann Thompson is here. And Ann, explain what the warning is here.
Tom, this study says prolonged use of melatonin is linked with a higher risk of heart failure and early death in adults with insomnia. It's not that melatonin causes these problems. Rather, its use is an indicator of problems because insomnia can increase your blood pressure and inflammation, leading to serious cardiac troubles. This study looked at the electronic medical records of more than 130,000 adults with chronic insomnia. It found those who took melatonin regularly for at least a year were nearly twice as likely to develop heart failure and more than 3 times as likely to be hospitalized for the issue. Melatonin is a popular sleep supplement. If you have concerns, the best advice is to talk to your healthcare provider, Tom.
Always check with your doctor.
Well, this is an interesting study. It's being presented at the American Heart Association meeting that's taking place November 7th through the 10th in New Orleans this year. And a study was done by an internal medicine senior resident who led the study, Dr. Nadi, and he's presenting this there. It is not a peer-reviewed study. It is being presented as a scientific session at the conference. But let's get a little more detail about the study. Basically, it was looking at patients that they had electronic medical records from. It was a large population. It was 130,000 patients, but split between some patients were in Britain and some patients were here in the United States. And they were all within an electronic medical record system. Now, in Britain, melatonin can only be obtained through prescription, where in the United States, it's over the counter. And we don't know how many of these patients that were in the study were from Britain, how many from the United States, but only those that were in Britain is a really reliable data on terms of how much they were taking and when they were taking it. Those that were in the United States, we really don't know. But the data was looking at hospitalizations of people that had insomnia listed. And there's more than one type of insomnia. So we don't know whether it was the difficulty falling asleep or difficulty staying asleep, but it was people that had insomnia listed in their diagnoses, and that to see how many of them were admitted with heart failure. And when they looked at these insomnia patients, they found that those that had been taking melatonin within the year prior to coming into the hospital, there was a much higher occurrence of those insomnia patients having heart failure than those that had insomnia listed that there's no documentation of them having taken melatonin. So for those taking melatonin, 19% of those that were hospitalized were diagnosed with heart failure, where only 6.6% of those with insomnia actually were also diagnosed with heart failure. But that does not mean that melatonin causes heart failure, all right? And then when we looked at death, they found that in those that were taking melatonin, there was 7.8% of those ended up having death, as compared to those that were not taking melatonin, it was only 4.3% of those patients. Now, you have to think of heart failure is going to cause disruption of sleep. And it may be associated with things like sleep apnea, which was not really clearly controlled very well in this study. But a lot of people taking melatonin would be doing it because they're having problems with their sleep. And those that are more severely affected with disrupted sleep might also be those that are more likely to seek out a remedy such as melatonin. Although the study is interesting and it does show that there is an increased occurrence of people that have heart failure taking melatonin, it by no means demonstrates that melatonin is the cause of the heart failure. So it's important to know. And more importantly is, as stated in the news article, that if you're having problems with sleep, you need to seek out medical attention. And a common cause for having insomnia can be sleep apnea that can lead to heart failure. So I'm Dr. Jerald Simmons, and here to educate you on sleep and hope to make you healthier. Thank you.